The best free NCLEX practice exam you haven't used yet. Question 1. The nurse is changing the ties of a client with a tracheotomy. The safest method of changing the tracheotomy ties is to: Option A. Apply the new tie before removing the old one. Option B. Have a helper present. Option C. Hold the tracheotomy with the non-dominant hand while removing the old tie. Option D. Ask the doctor to suture the tracheostomy in place. The correct answer is option A. Apply the new tie before removing the old one. Securing the new tie before detaching the old one guarantees that the tracheostomy tube cannot be accidentally coughed out during the procedure. Question 2. The nurse is providing discharge teaching for the client with leukemia. The client should be told to avoid: Option A. Using oil or cream-based soaps. Option B. Flossing between the teeth. Option C. The intake of salt. Option D. Using an electric razor. The correct answer is option B. Flossing between the teeth. Leukemia causes profound thrombocytopenia. Flossing can easily traumatize fragile gingival tissue, causing severe, uncontrollable oral bleeding. Question 3. Which of the following positions would best aid breathing for a patient with acute pulmonary edema? Option A. Lying flat in bed. Option B. Left side lying position. Option C. High Fowler's position. Option D. Semi-Fowler's position. The correct answer is option C. High Fowler's position. High Fowler's position, sitting straight up at 90 degrees, relies on gravity to pool fluid in the lung bases, freeing up the upper airways for vital oxygen exchange. Question 4. Which of the following interventions should be your first priority when treating a patient experiencing chest pain while walking? Option A. Have the patient sit down. Option B. Get the patient back to bed. Option C. Obtain an electrocardiogram. Option D. Administer sublingual nitroglycerin. The correct answer is option A. Have the patient sit down. The immediate priority during an angina attack is to drastically reduce myocardial oxygen demand by immediately ceasing all physical activity and having the patient sit down. Question 5. In which of the following types of cardiomyopathy does cardiac output remain normal? Option A. Dilated. Option B. Hypertrophic. Option C. Obliterative. Option D. Restrictive. The correct answer is option B. Hypertrophic. In hypertrophic cardiomyopathy, the heart muscle thickens significantly. Although filling space is reduced, the powerful contractions initially maintain a normal cardiac output. Question 6. Which of the following signs and symptoms usually signifies rapid expansion and impending rupture of an abdominal aortic aneurysm? Option A. Abdominal pain. Option B. Absent pedal pulses. Option C. Chest pain. Option D. Lower back pain. The correct answer is option D. Lower back pain. Sudden, severe, tearing lower back pain indicates that an abdominal aortic aneurysm is rapidly expanding and pressing against the lumbar spinal nerves just prior to rupture. Question 7. What is the first intervention for a patient experiencing chest pain and an oxygen saturation of 89%? Option A. Administer morphine. Option B. Administer oxygen. Option C. Administer sublingual nitroglycerin. Option D. Obtain an electrocardiogram. The correct answer is option B. Administer oxygen. Oxygen is the most critical immediate intervention when saturation falls below 94%, especially during ischemic chest pain, to prevent myocardial tissue death. Question 8. The physician has ordered a histoplasmosis test for the elderly client. The nurse is aware that histoplasmosis is transmitted to humans by: Option A. Cats. Option B. Dogs. Option C. Turtles. Option D. Birds. The correct answer is option D. Birds. Histoplasmosis is a fungal infection caused by inhaling spores found heavily concentrated in soil contaminated by bird and bat droppings. Question 9. The client has recently returned from having a thyroidectomy. The nurse should keep which of the following at the bedside? Option A. A tracheotomy set. Option B. A padded tongue blade. Option C. An endotracheal tube. Option D. An airway. The correct answer is option A. A tracheotomy set. Post-thyroidectomy swelling, hemorrhage, or laryngeal nerve damage can cause a sudden, total airway collapse, requiring an immediate emergency tracheotomy. Question 10. Which task should be assigned to the nursing assistant? Option A. Placing the client in seclusion. Option B. Emptying the Foley catheter of the preeclamptic client. Option C. Feeding the client with dementia. Option D. Ambulating the client with a fractured hip. The correct answer is option C. Feeding the client with dementia. Feeding a stable patient with dementia is a routine, standard task that falls within the established scope of practice for unlicensed assistive personnel. Question 11. A client with frequent urinary tract infections asks the nurse how she can prevent the reoccurrence. The nurse should teach the client to: Option A. Douche after intercourse. Option B. Void every 3 hours. Option C. Obtain a urinalysis monthly. Option D. Wipe from back to front after voiding. The correct answer is option B. Void every 3 hours. Frequent voiding flushes bacteria out of the urethra before they have a chance to migrate upward and establish a bladder infection. Question 12. The nurse has a preoperative order to administer diazepam 10 mg and promethazine 25 mg. The correct method of administering these medications is to: Option A. Administer the medications together in one syringe. Option B. Administer the medications separately. Option C. Administer the diazepam, wait 5 minutes, and then inject the promethazine. Option D. Question the order because they cannot be given at the same time. The correct answer is option B. Administer the medications separately. Diazepam is notoriously incompatible with almost all other medications and will precipitate instantly in a syringe, so it must be administered completely separately. Question 13. Which of the following signs of increased intracranial pressure would appear first after head trauma? Option A. Bradycardia. Option B. Large amounts of very dilute urine. Option C. Restlessness and confusion. Option D. A widened pulse pressure. The correct answer is option C. Restlessness and confusion. Changes in the level of consciousness, such as subtle restlessness or confusion, are the absolute earliest indicators of rising pressure inside the skull. Question 14. Which of the following nursing interventions should you use to prevent foot drop and contractures in a patient recovering from a subdural hematoma? Option A. High-top sneakers. Option B. Low-dose heparin therapy. Option C. A physical therapy consultation. Option D. Sequential compression devices. The correct answer is option A. High-top sneakers. High-top sneakers effectively hold the ankle in a neutral, anatomic position, physically preventing the Achilles tendon from shortening and causing foot drop.